Jenny Ann, thanks for joining us today. It's really nice of you to take the time out. Would you like to introduce yourself?
Yes, I'm Jenny Ann Bishop. I live in Rhyl in North Wales, and I've been trans all my life from about 3 or 4 years old. But because I grew up in the 1950s, 1960s, it was almost impossible to transition or have medical treatments. So I brought up a family, and eventually, when after 30 years my marriage failed, I felt it was time for me to be myself. So I transitioned starting in my late 50s, early 60s. And um, once I retired, about 13, 14 years ago, I was able to spend more time working with the community. So I'm currently chair of a support group in North Wales, Unique, and one in Manchester, Manchester Trans Forum, and I work with a number of the public service providers, and including the police and the NHS, to try and improve service provision and understanding of trans people.
Thank you. And you were quite rightly awarded an OBE for your contributions, and many congratulations for that.
Oh,
So
thank you.
deserved. So we're going to talk to each other a little bit about genital surgery, and you've so kindly agreed to talk with me about that. You know, for the purpose of sharing your experiences. And I'd like to start, as I have in the other film that I made, by asking you what did you have, and when did you have it, and where did you have it?
Yes, I had a labioplasty in October 2010, and if memory serves me well, it was the 13th, so quite a key day. And I had it at the Charing Cross Hospital in London, and my surgeon was James Bellringer.
Okay, great, thank you. So we're looking at sort of 10 years ago, almost
Yes,
today, really, isn't it? You can you've just passed that landmark, actually. So brilliant.
yeah,
And I think what I'd like to explore with you, if I may, is your decision-making process around what type of genital surgery you opted for. Whether it was always the case that you wanted to have the labiaplasty, aesthetic labiaplasty procedure, or whether
yes.
you had to weigh up your options at the time.
Yes, it was certainly quite a process, because I was living with my partner, Ellen, who's also a trans woman and who I'm married to now. And um, one of the things that was of big concern to me was how it would change our um, how can I put it, our sex life together, because obviously up to that point we both had male genitalia, and we were reasonably happy exploring that and pleasuring each other. And I knew that that for Ellen would change because she enjoyed looking after me as I enjoy looking after her. And we had a very long discussion about whether I should have a vaginoplasty or a labioplasty.
Right.
One of the things that I was really concerned about was, having changed, would she want to be quite desperate to have sex in the conventional way with a woman? And she reassured me by telling me that firstly, she thought I didn't have enough skin to make a big enough vagina because she's quite big. Also, she said to me, well, as you know, before I met you, I had a relationship with another trans woman. And for me, it really didn't work properly.
Right. Okay.
So there was an element there of saying, well, Jenny Ann, I'm not sure it's worth all the effort. And then we discussed the possible complications with having the full surgery, the having to look after your vagina for the rest of your life, to dilate quite extensively and possibly quite painfully to start with. And we decided pretty well that that really wasn't a good option. One of the things I was concerned about, and one of the reasons why I wanted to have surgery, was because being an older woman, I felt that in later life I might need close personal care. And I didn't want any of the caregivers being shocked or laughing at me because I had a combination of male and female in my body. And the thing that finally did it for me was one of my older friends had vaginoplasty about 3 or 4 months before my surgery, and she suffered really badly with a difficulty with her vaginoplasty. She got an infection that nearly killed her. And my friend went from a fairly active woman about my age to what I thought was a little old woman I didn't recognize when I visited her in hospital. And as you can imagine, that made me sort of think, I think I'm definitely on the right track by having the labiaplasty only. And I found that that was exactly right for me.
Great. So it sounds like you weighed things up. You made a clear list of what your priorities were. What is it that you want it for, in negotiation with your partner, of course, although we always say your surgery is fundamentally for you, because partners, not Ellen, of course, but partners can come and go. But you, in the context of your marriage or your relationship, you weighed things up and you had those discussions, as well as having context in terms of other people able to share that lived experience, some of which, of course, was negative, and this poor friend of yours having a poor outcome was probably another thing that you added to that list for the labiaplasty procedure as opposed to the vaginoplasty procedure.
Yes, and that discussion with my partner probably lasted about 6 months. Because once I'd got my first referral for surgery, then we started talking about it and what outcome we both wanted. I believe a relationship works really well if you can discuss everything with your partner and you consider their needs as well as your own, and you don't try and make them something they're not.
Yes, I think it's certainly important to be realistic and open with whoever's involved, but fundamentally not feel coerced or controlled into making a decision that's not yours. So it is about that balance, and I know that you've known Ellen a number of years, so it made sense for you to do that. Absolutely.
Yes.
You would have been aware going into or making that decision that, I think James talked about it when we had our conversation, is that one of the things about the aesthetic labiaplasty procedure is that once that's been completed, the skin that would otherwise be used potentially to create a vagina has been lost.
Yes.
It is definitely something that you need to be sure about, because it's then very difficult to convert that into a vagina. Well, it's pretty impossible really in terms of the penile skin inversion technique. So it was a decision that it sounds as though you took very seriously and carefully, meticulously.
Yes, absolutely. And I have to say, since I had surgery, I've very occasionally, it's gone through my head, as I'm sure it would for everybody, it would be nice to have full sex with my partner. And that thought has lasted precisely 5 seconds, because I thought, well, there were lots of risks in doing that. There'd be lots of work. How do you know it would even work properly from the experiences Ellen had had? And also because I'm an older woman and because my T is incredibly low, most of the time I don't think about sex or feel sexy.
Right. Okay. And by T, you mean testosterone levels?
Testosterone, yeah.
So yes, and in terms of, so you went in, that was the surgery that you consented for, that was the surgery that you had. I wonder
Yes.
if you just very briefly wanted to share any pertinent memories that you think would be helpful for other people, or that were, that were worth sharing, about either the preoperative or that period, that post-operative time.
Yes, I think there are several things I'd like to say. Firstly, when I went for my appointment with James Boehringer, I got my two signatures to refer me to the surgeon, but I'd somehow got in my head that I'd see the surgeon, they'd do a physical to check everything was okay. I made sure my BMI was low enough and my bloods were up to date and so on. And I expected then James to say, right, go away and think about it, and then we'll see you again and you make the final decision. So I was quite surprised at the end of the physical examination. He sat down, wrote a little note, gave it to me and said, now go across to the hospital and book your surgery. And I was like, what? I was not expecting that. And I had to rush out and ring my partner Ellen and say, you'll never guess what's happened.
So exciting.
Oh, it was. And I was like on cloud nine all the way back from London to North Wales.
Yeah,
And I
brilliant.
couldn't wait to talk to Ellen in great detail about what had happened. And the other thing I was really surprised about, because I felt that to a degree my surgery was to bring my body in congruence with my identity. I hadn't got terribly excited about it. I'm one of those people who plans something, decides what's going to happen, and if it's some time away, I then put it in the back of my head. And I can remember all my friends about a week before surgery saying, aren't you getting really excited, Jenny Ann? And I was like, no, it'll happen when it happens, and I shall then get excited.
Yes.
And one of my friends gave me a lovely gift to take to the hospital. She bought me a nice teddy bear that said special friend on the front. And when she gave it to me, she said, I've loaded it up with hugs.
Oh,
Give
sweet.
it to all your friends and Ellen to hug. And then if you feel sad or lonely, you can get a hug.
Lovely, of course, because it can be quite lonely on the ward there. You're quite far from home. It's very
Yeah,
difficult to accommodate support in the hospital, and it's quite expensive for friends or partners or family to stay in London. So
yes,
sometimes that time on the ward is really important, that you've got that extra reminder of home and your friends, which is lovely.
it
Um,
is.
yeah. Did you, and I think that idea that you said that you put it to the back of your mind, it's something that we hear quite a lot of, actually, and I think it's a bit of a coping strategy,
It is.
um,
Yes.
to manage expectations, and it's probably a sensible one. So I'm glad
Yes.
you I'm glad you got excited eventually about it when the day finally arrived. I'm sure you were pretty
Yes.
excited.
So
It's actually happening.
yes. So I have to say I went into the surgery not having huge expectations, because again, I'm a person who works on this is the minimum I expect. if I get any more, that's a bonus. And then I'll get happy and excited. And
Yeah.
when I woke up from the surgery, I was in this incredible state of euphoria. And I was not expecting that. It hit me like a brick wall. It was like, why am I feeling this good? It's just incredible.
Right.
And I said, I went from gender dysphoria to gender euphoria in a couple of hours.
Yes. Well, modern anaesthetics are pretty good in terms of helping you feel quite high, but we do warn some people for some reason are quite susceptible to what we call the post-op blues, which
Yes.
is simply actually the breakdown products of the anaesthetic agents can abruptly affect mood. It tends to last a day or two, and then people feel absolutely ecstatic and thrilled again.
Yes.
And we think it is simply just the breakdown products in the body of the anaesthetic being processed by the body. And for some people, it does seem to affect their mood in the opposite way, and we don't know why that is. So
Yeah.
we do warn people about that, just to prepare them, in case they wake up feeling awful and think, oh gosh, have I made this terrible mistake? And of course, it's nothing to do with that. It's to do with the anaesthetic itself. But I'm glad you felt high, on the higher side. That's fabulous.
I did. And it had a big effect on my recovery because I got taken back. I was put in a side room initially. And when I got back, they offered me the usual morphine pump. And I said, no, I don't feel any pain really. And they came back in the evening and said, you haven't used your pump. And I said, well, no, I don't need it. And the next morning when I woke up, I got myself out of bed and went to the loo, pulling all the trolleys with the bags on behind me.
Oh gosh.
Or at least I emptied my bag. And I came back and I was sitting in the chair when the nurse came in and she said, what are you doing out of bed? And I said, well, I'm perfectly okay. I'm on the recovery road.
Yes, and James talked about the fact that they do put a numbing injection into the spine, which really helps with pain control. But of course, you think absolutely nothing wrong with me, and off you went, so brilliant.
Yes, that's right. Later in the day, the nurse came in and said, do you want to go and join all the other girls on the ward? And I said, oh, yes, please. I don't want to be here on my own. And also, I'd taken with me some books I enjoyed reading, one of which was about the fundamentals of gender. And I read that, and it was great because when it got boring, I simply fell asleep.
Yeah, it's quite a nice experience coming around from an anaesthetic. It's sort of dreamy and enjoyable. Tell me, as time went on, obviously, you're 10 years on now, and I'm really keen to talk about how life is now, 10 years later, particularly as an older woman as well in that context. But talk to me, were there any particular complications that you wanted to share, or difficulties that you wanted to share with the people watching this video?
Yes, I think there are two things I'd like to share, which really the hospital didn't tell me about. I suspect they do now because some of us have talked about it. Firstly, that you're very likely to get a urinary tract infection. Whilst you learn, you need to be much more careful about hygiene than you were with your old body. And I've had over the years, every so often I get a UTI and I have to go and get an antibiotic from the doctor. And also I was lucky in that one of the key people in our support group was a woman who's not trans. And she said to me, oh yes, Jenny Ann, you're learning what it is to be a female.
Yes, because of course the urethra, the tube where we pass urine, is a lot shorter.
Yes.
And anatomically that means that we're more at risk of urinary infection.
Yeah.
And I'd love to talk about, things in terms of now. How did you find um, the your new body over the years? Has it functioned in the way that you were expecting it to? Had you managed expectations around that, or had it exceeded your expectations in terms of sexual function, sensation, and all those sorts of things?
Yes, I think it was at least as good as I expected. Recovery was much faster than I expected. I expected to be sort of laid up for a month, but after the first couple of days, I was getting dressed, doing my hair, and going and sitting in the day room and reading rather than laying on my bed. And I remember one of the nurses came in to do the regular checks, and I said, "Oh, I'm sorry, I'm not in the ward." "No," she said, "Jenny-Ann, you're doing the right thing. All those people laying on their beds are going to have a huge shock when going home day comes."
Yeah, absolutely. And how is everything now? So over the last
It's
10 years?
fine. And what I'd like to say too is when I got home, again, I expected to feel debilitated for quite a while. And I think the week after the week I came home, Ellen came out to our workshop and said, "Jenny-Ann, what are you doing hauling furniture and making things in the workshop? You're supposed to be recovering." And I said, "But Ellen, I've got so much energy."
So brilliant. So it sounds like your immediate sort of first 6 weeks and few months were excellent, and there were no
They
problems.
were, yes. And now, 10 years later, apart from the occasional urinary infection, I don't notice anything wrong.
Great.
And I'm very happy with what was done. The only time I've had a doctor look at that part of my anatomy, the doctor said to me, "Wow, that's really nice surgery. And if you hadn't told me, I'd have thought you were just a woman who'd had a hysterectomy."
Mm,
Because when they do the surgery, even though you're not having the vaginoplasty, certainly my surgery, they made a little indentation where the vagina would have been, as if it's just been sewn up after having the cervix removed.
yes, and James actually talked about that they do provide a little indentation there, just for that cosmetic purpose, just to give it
Yes,
that look. So that's great.
yes,
That's absolutely fantastic. So let's bring it together in terms of the context of being an older woman. I'm
yes,
assuming now that you are of postmenopausal age, so
yeah,
you're probably on sort of a low dose maintenance HRT regime of
yeah,
estrogen, just to protect your bones, maintain your fat distribution, and keep that ticking along.
yeah,
Obviously, you would no longer have needed the testosterone blocking injection after surgery, so you would have done away with that. In yourself, the prostate gland won't have moved anywhere because you didn't have a hole created in your perineum for a vagina to be
no,
placed there. So the prostate gland for you is still accessible if a GP needed to examine you from
yes,
from behind. That
yeah,
would be a standard way of doing it for you. In people that have had a vagina created, obviously the prostate gland moves slightly, and I think what we're very keen to make sure of is that GPs are aware, A, that the prostate gland is there, and
yeah,
B, they understand how to examine for it, because they
yeah,
might find if they did what's called a rectal examination from behind, they might not feel much. They'd be feeling the vagina there. So this is all really important information for people to be reminded of, both patients and healthcare professionals, to make
yeah,
sure that if somebody is concerned or might have some symptoms of a prostate causing problems, that they can be reported and properly examined for and investigated. In terms of any final comments that you might like to make, any final messages that you have for people watching this conversation, over to you.
yes. I think a couple of things. Firstly, I've been very satisfied with having the surgery I chose. I haven't had really any disappointment at all in it. So I think it's important you have those discussions about which surgery, if necessary, discuss it with your clinician at the gender service and with your surgeon, who will be able to really help you understand the pluses and the minuses. And I think the other message is it's never too late to have surgery if that's what you want. Not everybody wants surgery, and that's perfectly okay too. But if you do want it, my oldest friend so far to have had surgery was 82 when she had a vaginoplasty, a very fit 82, I have to say. And she's still perfectly fine with that.
Thank you so much. I've thoroughly enjoyed talking with you. Thank you for sharing this invaluable insight and experience with all of us. I really appreciate it. Thank you so much, and take care, Jenny-Ann.
And you, Sophie, thank you. I'm glad to have been able to impart a little to your list of little films you're making around this.
Thank you.